We all feel sad sometimes. It's a normal part of life, like feeling happy or angry. Maybe you didn't do well on a test or your favorite team lost a big game. These things can make you feel down for a bit, but the feeling usually passes. Depression is different. It's not just feeling a bit sad. It's a serious illness that affects how you feel, think, and act. Imagine feeling a heavy sadness that just won't go away. You might lose interest in things you used to enjoy, like spending time with friends or playing your favorite video game. It's hard to concentrate, and even simple tasks feel overwhelming. Depression can make it tough to sleep, or you might find yourself sleeping much more than usual. Your appetite might change, and you could lose or gain weight without meaning to. These are just a few signs that what you're experiencing might be more than just the blues. It's important to remember that everyone experiences emotions differently. What looks like sadness in one person might be a sign of depression in another. If you're concerned about yourself or someone you know, the best thing to do is talk to a trusted adult or healthcare professional. Clinical depression, also known as major depressive disorder, is a medical condition. It's not a sign of weakness or something you can just snap out of. It's like having a cold or the flu, but instead of affecting your body, it affects your brain and how you feel. To be diagnosed with clinical depression, you need to have certain symptoms for at least 2 weeks, and these symptoms must be severe enough to interfere with your daily life. These symptoms can be different for everyone, but some of the most common ones include media group of people showing different emotions, individuals displaying various moods at distribute underscore equally, feeling sad, hopeless, or empty most of the time, losing interest in hobbies and activities you used to enjoy, changes in appetite or weight, sleeping too much or too little, feeling tired and lacking energy, having trouble concentrating, remembering things or making decisions, feeling worthless or guilty, and having thoughts of death or suicide. If you're experiencing any of these symptoms, it's crucial to reach out for help. Talking to a doctor, therapist, or counselor is the first step towards feeling better. Depression doesn't just make you feel sad, it affects your whole body and the way your brain works. Imagine your brain is like a computer. When you're depressed, it's like some of the wires are crossed, and the computer can't run properly. This can affect your thoughts, feelings, behavior, and even your physical health. For example, depression can make it hard to focus in school or remember things. It can also make you irritable and quick to anger, even over small things. You might withdraw from friends and family and stop doing the things you used to enjoy. Physically, depression can cause headaches, stomach aches, and muscle pain. You might feel constantly tired and have trouble sleeping, even if you're exhausted. Depression can also weaken your immune system, making you more susceptible to getting sick. It's important to remember that everyone experiences depression differently. Some people experience a few mild symptoms, while others experience many severe symptoms. There is no right or wrong way to feel. So what causes depression? It's a complex question with no easy answers. It's not caused by one single thing, but rather a combination of factors, like genes and life experiences. Think of it like this. Imagine you have a recipe for a cake. You need flour, sugar, eggs, and butter. But if you use too much flour or not enough sugar, the cake won't turn out right. Depression is similar. Genes play a role, just like the ingredients in the cake. If depression runs in your family, you might be more likely to experience it yourself. But genes aren't the whole story. Life experiences like trauma, stress, or grief can also contribute to depression. Think of these life experiences as the oven temperature or baking time for our imaginary cake. Even with the right ingredients, if the oven is too hot or you bake the cake for too long, it won't turn out right. It's important to remember that you can't always control the ingredients or the oven, but you can control how you respond to the situation. If you're feeling depressed, know that you're not alone, and there is help available. If you think you might be experiencing depression, the most important thing you can do is talk to someone. This could be a parent, a teacher, a school counselor, or another trusted adult. They can listen to how you're feeling and help you connect with a mental health professional who can provide support. Sometimes it can be hard to talk about these feelings, even with someone you trust. You might worry about what people will think or be afraid of being judged. But remember, depression is a real illness. and there's no shame in seeking help. In fact, it takes a lot of strength and courage to reach out for support. There are many effective treatments for depression, including therapy and medication. Therapy can help you understand your thoughts and feelings and develop coping mechanisms for managing challenges. Medication can help to correct chemical imbalances in the brain that contribute to depression. Remember, it's okay to not feel okay. It's okay to ask for help, and there is hope for a brighter future. With the right support and treatment, you can overcome depression and live a full and meaningful life.